Hi, in this video I'd like to talk about the management of miscarriage and recurrent miscarriage. So in many hospitals, we like to call them blind management of miscarriage or threatened miscarriage. Now we cannot really blame the doctors because a miscarriage is a very urgent and a high emergency, high risk situation. So your doctor, he might not be an expert in the area of dealing with miscarriages, and they might just follow some standard protocol, some standard treatment protocol in cases of any potential miscarriages if these patients show up. And we like to call these blind management or blind treatments of miscarriage. Here at Antai Hospital, we'd like to bring some awareness so that you can equip yourselves with some knowledge, and then also find a specialist hospital or even find a doctor that knows what he is doing. Now, what does blind management mean? So blind management means that when the doctor observes symptoms of a potential miscarriage, so you're probably experiencing abdominal pains, lower back pains, and then vaginal bleedings. Now these are all signs of a potential miscarriage during pregnancy, and what they do is that they quickly administer you with some progesterone supplementation. This is one of the most common management methods of a potential threatened miscarriage. Now, why do they do this? Is because 8 out of 10 times it works, because they know that it might be suited to the underlying cause. But what if it's not suited? If it's not suited, then it will not stop the threatened miscarriage. So this patient will unfortunately lose her pregnancy. Now this is considered blind management because they are not doing it according to the underlying factors. Another common blind management is using heparin and aspirin. These are anticoagulants, so they can make the blood very thin. Now they believe that if there's a blood insufficiency miscarriage, if there's a lack of blood flow in the reproductive system affecting the pregnancy, they will give her heparin and aspirin. Now this may or may not work because they can't really perform a full systemic diagnosis or treatment because the patient is pregnant, and maybe 7 out of 10 times, 8 out of 10 times it might work. But then there are some patients who will suffer a miscarriage because the treatment is not according to the underlying cause. And another common management is using lead therapy. They will just inject paternal white blood cells in hope that it can stop the threatened miscarriage, because nothing seems to be working. So here at Antai Hospital, we do things differently because whatever treatment that we administer to our patient, we take full responsibility. So let's say you do end up miscarrying after receiving our treatment, then we will have to refund full amount of the treatment cost to you, because this is a form of our guarantee and our assurance, and also a showcase of our years of experience in dealing with miscarriage management. So the point of this video is that miscarriage management needs to be according to the underlying causes. Let's say this threatened miscarriage is caused by a presence of a adenomyosis lesion, or presence of a uterine fibroid, or caused by corpus luteum insufficiency, or we need to do a diagnosis first before we give them the treatment. Regardless of how urgent the situation is, a hospital like Antai Hospital can give you an accurate diagnosis and also an accurate treatment. And if you do experience a pregnancy loss after receiving our treatment, we will take full responsibility and offer you a full refund guarantee. In our years of experience in this field, we have yet to fail, because in our years of experience, we've seen that with proper diagnosis, there can always be a positive treatment outcome.